Subcutaneous injection sites include your abdomen, your love handles, your outer thighs, the back of your upper arms, and the top of the buttocks. Subcutaneous needle lengths can be 3/8 of an inch, 1/2 an inch, 5/8 of an inch. They can be 20 through 25 or 26 gauge, and they would be injected at a 45 to 90 degree angle.
Make sure when you're preparing your medication that you remember the 6 rights: right patient, right medication, right dose, right route, right time, and right documentation. Also, be sure to check your medication with the Medication Administration Record, or MAR, at least 3 times: when removing the med, when preparing the med, and when giving the med at bedside. With that in mind, we can now begin our preparation. So first, there needs to be a doctor's order. Then you need to see if your patient has any allergies that could negatively interact with the medication that you're about to give. Then you would wash your hands. Next, gather your supplies. For subcutaneous injection, you'll need gloves, at least 2 alcohol wipes, your medication, your proper needle gauge and length, and your patient. So first, I'm going to clean the top of my vial. Then I'm going to inject the amount of air that I would be withdrawing, which is 0.5 milliliters. Then you're going to withdraw the amount of liquid that you need, or medication, which is 0.5. And if there are any air bubbles, which this one does not have any air bubbles in it, you would remove them either by flicking it or pushing the medication back in and trying to get it out, but there are none. So we can remove that. And then because this needle is still clean and I need to transport it to the patient's room, I'm going to recap it. And at this point, I could change the needle if I needed a longer length or different gauge. We have our prepared medication and all of our supplies, and we take it to our patient's room. We introduce ourselves to our patient, we explain what we're about to do, we wash our hands again, and put on gloves. We double check if our patient has any allergies, and then we check their labs, their recent labs and vitals, to make sure that the medication we're about to give is not going to negatively interact with any low or too high vitals or labs. So now we're ready to give our subcutaneous injection. First, we clean the skin with an alcohol wipe. And this is fatty skin. You're going to pinch it at least an inch of fat, and you're going to use a dart-like motion to stab the skin or to inject the medication at a 45 to 90 degree angle. Then you're going to slowly inject the medication. Then you'll release. And then you do not recap this needle, you put it in the sharps container. The sharps container is off camera. So when I've finished the injection, I don't massage the area of skin. I throw away my gloves, trash can's off camera. I will wash my hands again, ensure my patient is comfortable and not presenting any abnormal signs and symptoms. I would document what I just did, and that's how you give a subcutaneous injection.